I'm Brittany Lewis with Forbes Breaking News. The House Oversight Committee held a hearing Monday on the federal response to the opioid crisis. Congressman Khanna accused the Sackler family, Purdue Pharma, and other large pharmaceutical companies of contributing to the opioid epidemic. The Sackler family agreed to shell out as much as $6 billion earlier this year to settle litigation accusing their company Purdue Pharma, the maker of OxyContin, of contributing to the opioid crisis. The opioid epidemic has killed nearly 500,000 Americans. This deal would shield them from future civil lawsuits, but not criminal charges. Here's more from the California lawmaker.
Thank you, Madam Chair, and thank you for your leadership. It's clear that the Sackler family and Purdue Pharma, alongside with other major pharma companies, are responsible for massive crimes on the American public and the harm that they have caused with the opioid epidemic. We should read Beth Macy's work on this. They need to be held accountable. They shouldn't be able to hide behind bankruptcy court or shield their assets for the crimes they have committed on the American public. My questioning wants to focus on the current research that shows that cannabis can be a key alternative to opioids when it comes to relieving pain. Access to cannabis is associated with the reduced rates of opioid use and abuse, reduced rates of opioid-related hospitalizations, reduced rates of opioid-related traffic facilities, reduced rates of opioid-related drug treatment admissions. One study showed a 64% reduction in opioid use amongst chronic pain patients who used medical marijuana. Dr. Gupta, I appreciate your leadership. I imagine you and the administration are aware of these studies. Is that true?
Thank you, Congressman. We are closely monitoring these. As someone who has implemented a medical cannabis program in the state of West Virginia, I understand this work, and we're monitoring those studies as well.
Thank you, Dr. Gupta. Would you say, based on your experience, that it is true that cannabis use is a effective alternative for chronic pain patients?
There is evidence to suggest that in cases of certain chronic pain, cannabis can be efficacious.
Dr. Gupta, when it comes to acute pain, what category do opioid prescriptions fall under? Do you know, or I can let you know if you don't?
Most of the opioid prescriptions are class 2.
Exactly, Schedule 2. And yet, cannabis is still categorized as Schedule 1, as a Schedule 1 drug, which is the most heavily restricted category, and which prohibits scientists and researchers from conducting rigorous large-scale studies on cannabis. Just to be clear, this means that cannabis has more restrictive policies than currently opioids have, even though opioids have killed tens of thousands of Americans. Do you see this, Dr. Gupta, as a contradiction that needs to be resolved?
Thank you, Congressman. Clearly, the president has been clear about this in regards to the decriminalization, but also it's important for us to continue to look at this from a research perspective, from a medical use perspective. But it's clearly the policies that we've had in this country with regards to marijuana have not worked, and the president has said so.
I appreciate that, Dr. Gupta. I admire your public service. I know you have to be careful not to get ahead of the president, and you're being appropriately diplomatic in your responses. But I just, the president has the executive authority to direct DEA, HHS, and FDA to consider administratively rescheduling marijuana, which would facilitate research, which would facilitate patient access. I'm for legalizing, at the very least decriminalizing, but the president could at least make sure that it's rescheduled so it's not more restrictive than opioids themselves. Dr. Gupta, you don't have to make public comments, but can you assure the committee today that privately, at the very least, you will urge the president and the administration to follow the best judgment of science here and medical research, because that can really help in solving this problem?
Thank you, Congressman. I think it is the foundation for so many ways to proceed forward, including our current strategy is to follow science, follow data, and I can commit to you that we're going to continue to do that.
Thank you, Dr. Gupta. I just would hope you and the administration really will consider the rescheduling and to look at what can make a difference in patients' lives and resolve this discrepancy where currently cannabis, which is actually more effective and isn't killing thousands of people, is more restrictive than the opioids that have done so much harm in American life. And I appreciate your public service, appreciate your work, and thank you for appearing before this committee.
Thank you.
Thank you. The gentleman yields back. Representative Donald.